Well, good morning, everyone. Here it is, Monday morning, another non-work week, and I'm going to reach over and I'm going to open up to some page. Who knows what page? Oh, look at this. Oh, that's cool. So this is a great picture of the back of the head. Wow. And it's a great picture of all the layers of the muscles of the back of the head. So here we go. Let's identify a few and sort of talk about them, okay? So here, oh, let me get a pen. Let me do this. So let me see if I can get into the, okay, here we go. So here is your trapezius. And look at how high the trapezius actually, your trap muscles actually attach on the top of your head. The end of your skull is actually happening about here. So it's not happening so your trap is not coming and attaching at the very bottom of your skull. It's attaching all the way up a bit higher on the skull itself. So this is your trap, okay? Over here, this is your sternocleidomastoid coming in, attaching in the back of behind your ear. That one comes to the front. This comes to the front and attaches on your collarbone, basically, and your a little bit on your sternum. Underneath here is your splenius capitis, which is a muscle that when this muscle contracts, it turns your head so your nose would be facing this way. That's what that's doing. I'm going to change hands here, guys. Okay. Sorry about the movement. But I personally think this part's much more interesting. So this is the trap is cut away and the splenius capitis, see here? All this is cut away here. These are your suboccipital muscles right in here, okay? Right in here. So you have posterior suboccipital muscles and you have the matching set, the anterior on the anterior side. Maybe one of these days I'll pull that up on purpose. And what these do, this attaches to your first cervical. Oops, I have to think about this. This is attaching actually to the second cervical and then up to the head and attaching here from the second cervical out. And these are called, actually these suboccipital muscles are called rocking and tilting. And that's because these muscles actually rock your head backwards and they also rock your head sideways. But the more interesting thing about these muscles is that they are actually related to your eyes, because that fine movement of your head to be able to look for danger or look for what's coming or what's around you is happening because of the actions of those muscles. The big gross movement where you really tip your head way back and stuff like that is not coming from these guys. These are the fine little movements that you have. So I always think these guys are much more interesting to me, because I'm all about what's happening at the very, very core level. So these are rocks and tilters. So if these are tight, it's really going to make it difficult for your eyes to function completely. So it's not that the nerves connect these, it's just that the action of these are actually connected to how your eye works. So anyway, I'll leave you with that today, guys. Have a great week. I'm sure I'll check in tomorrow morning, and I look forward to talking to you. Thanks.